and understand numbers on, I don't know at what point, if you do have numbers, but those that are rejected of medical service from MMC, I think my issue or concern maybe is the fact that I don't know at what point they would make it on the metric versus simply just being discouraged and saying, I'm out and going somewhere else. But I'd like to have an understanding whether MMC takes a look at that, whether you deny services or not.
Okay.
And while not necessarily, and I don't know how to quantify this, but one of the concerns that I've seen is as MMC and heck, even Mountain View, and I know Mountain View is not part of this discussion, but as you all have worked on, I don't know if consolidating is the right word, but as you all have started to grow across the city and have more providers that are under the MMC umbrella, one of the things that I've seen is that as you've opened, and that's why I say it's not just you, I think this is the industry-wide, as you all have started to grow, you all have opened urgent care centers, which is great for the city because we need to go somewhere to receive urgent care. We have a place to go. Unfortunately, what's happened is it's become very hard to be able to get appointments with even a provider within your network, which then drives us to urgent care. But as you build your urgent care facilities, now Memorial Medical Center, Mountain View, and everyone else charges a facility fee as if we were going to the hospital, not the same price. And I think I noticed the wordsmithing earlier. It's based off of insurance contract rates. But instead of me just simply paying a fee to see my doctor, I now pay a facility fee, I pay a doctor's fee, and then any other fee that may be associated with the services I receive at that time. So slowly, as you all have increased services, there's been an increase in being able to receive that care. And so I don't know, and I'd be curious, maybe it's just in the financial reports, as the chairman had noted, but I'd be curious to understand, how those services are tied
Okay.
to that.
Yeah, and I think it's maybe just kind of like a breakdown of how the payment structure actually works. Because if you're going into a PCP, just like, I am with my insurance, I have copays that I need to pay. If you're getting certain services, there may be a professional fee for the doctor's fee, and then you may have a facility fee like you spoke about. But that's throughout the healthcare industry in the United States. It's not just here in Las Cruces that occurs. And so, like LT said, I think it's very complex. Healthcare is complex, right? But maybe just breaking that down so everyone kind of understands why there are different charges for different things because of the way that the insurance industry sets up payment and how providers are actually charging for their services as a separate entity. So I think that would be important to address and kind of provide an overview.
Oh, and I that would be great because I think, as I said, if it goes back to some of the concerns that were raised, I said about and this goes back to the MSNBC story around cancer care, how those are being reimbursed or not, and then where does MMC, what are the patient's rights at that point? Because, like I said, I think as it was noted, I think yesterday there's only been a handful of patients that have been denied care, but I find, and that's why I say maybe people aren't making it on your radar because they're not being considered part of your metrics, and maybe because they just give up and go somewhere else. But I've heard multiple stories from multiple people that have been denied care at Memorial Medical Center, and they've had to travel to Albuquerque or somewhere else. And what makes it even more challenging is that when you have a person who may not be a documented immigrant that may not be able to travel past the checkpoints, their opportunities to receive care is even more limited. It's somewhere that they're going to be within Las Cruces or in El Paso. And so I think that's one of the other concerns that we have. So I look forward to having a joint session, or joint, whatever, however it looks. But I really do look forward to having further discussion. I will say though, Ms. Armijo, I know while all these concerns or all these questions are being brought up, I know the care that I have received when I had to go to Memorial Medical Center, the staff there has been phenomenal. And I will say that back in 2018, when my wife had to take our daughter to the PICU at the hospital, the nurses and the doctors were amazing. And so I know the staff for MMC, those that provide the care with all the people that go there, work hard and put in the time to make sure they're caring for each and every one of those patients. So I just want to make it clear that the questions that I have, I think, are really around, I think, the agreement, how it's being met, and the overall picture, but definitely not around the team that are there providing the services at MMC.
Awesome. Well, thank you for that, Commissioner Sanchez. We do have a very fantastic team there. You know, people that work at Memorial, we are very prideful of our culture. You know, I feel like we are a family, and we strive each and every day to do the best that we can to care for the patients in this community. So thank you for your comments. We appreciate that.
And then just one more thing, because we got the packet this morning right before the meeting, so we didn't have a chance to look at it. But one of the questions that I would definitely have during the work session would be if you guys can break out the charity and other uncompensated care, the 53, almost 54 million that you guys have listed, if you can break that down as to what that actually includes, because under community benefit program, the 1.7 million, it's broken out in the sheet, which I appreciate. But it says financial and in-kind contribution, professional development, tuition, reimbursement, community health services, and physician recruitment is listed in that 1.8 million. But down at the bottom, it says the charity care, that 54 million, includes physician recruitment costs. So it's kind of double listed, and I'm wondering what salary, wages, benefits, and contract labor cost. So is that part of your payroll then, the 54 million?
I would have to look to see what's stated on there, but we can break it out for you, so you have accurate numbers, and that way you can.
Yeah, I just
compare
saw
it to
that,
what
and I
you
would
have.
definitely be interested in seeing that, but thank you.
Okay.
Any other questions from the commission or the board? Commissioner Murillo, do you have any questions?
No, sir. Thank you.
Okay,
Okay. Thank you very
you.
much. Thank you for the feedback. We appreciate it.
Ms. Michael.
So thank you all for the presentation and for the questions. Aside from the proposed work session, my intent is, I attended my first meeting in May as the designee for the county, and now I know what information is available. And I will share that with you all. And I would like to come up with, that's kind of monthly or year-to-date information, because those meetings happen each month, around financials and around a lot of quality measures directly related to patient care in the hospital. So I will share what I have, and then we can figure out if you want something different or more than what I receive each month, and how frequently you want that. And I've already spoken with the leadership team here, and they're willing to help create any type of report that you all would like to see at whatever frequency you would like to see it.
Thank you.
Thank you. And I'll wait here for the next agenda item.
Oh, wait, what? Oh,
I would recommend going ahead and pushing through.
we had to meet with Slavin before.
Right, well, they
We're already
asked at noon, but I think I'd recommend taking care of the $200,000 on the cancer.
Meg, can you see if there's another time today that they're available? Okay. Okay, perfect. Okay, perfect. So then we are going to revisit item number 2, which was on the consent agenda, which was to award a contract to MMC for outpatient oncology and chemotherapy services in the amount of $200,000. Ms. Michael.
Thank you. Jamie Michael, County's Health and Human Services Department. After the board expanded these services available under the county's healthcare assistance program, we looked to see the best way to procure cancer care services in our community, and it was determined that a contract with Memorial Medical Center would be the best way to help people who qualify for the county's healthcare assistance program also access cancer care in the community. So what you have in front of you is a contract. It's a draft contract, but I believe it is in the final or very close to final draft. For cancer care, it will be outpatient cancer care. It complies with the Healthcare Assistance Program resolution, so the qualifications are the same as it is for other services under the HCAP program. And there is a $50,000 per patient per year fiscal cap. And the way that Memorial has designed the contract is regardless of how much
You know, is there a chance, is there an opportunity for us in the county to be able to look at providing additional funding for this? I want to make sure that we're not going to be limited on the people that we help with this.
Yes.
And then they, then they get, turns out that they go and then they find out there's no more, there's not a balance there, and then they're not able to get care.
Mr. Chair, Commissioner Sanchez, this kind of wasn't just arbitrary. First, we looked at data from Memorial Medical Center, and each year they get between 900 and 1,000 referrals for cancer care. That's an average over several years. And they were, based on their data, 3 or 4 people a year on average don't have access to any other coverage. So the first step, because we're the payer of last resort, so the first step is going to be to try to connect people to all of the other resources that are available. If there are no other resources that the individual qualifies for, then we will qualify them or determine if they qualify for this program. So we just did 4 based on the current historical data for the need. If we get a couple months into this and we're already at 2 people, and we know that the referrals are coming in faster, we will come back to the board immediately. I think the determination that the board here will have to make is where will the additional funding come from? We are already, so with the Healthcare Assistance Fund, our expenditure budget already exceeds our revenue budget. Mid-year, sometimes we're able to balance that out because our revenues come in higher. So there may be, a determination if you want to dedicate more money to this, where is the money going to come from? Right now, the $200,000 is approved in the budget for next fiscal year.
I second Commissioner Murillo.
Okay, we have a motion by Commissioner Sanchez, and we have a second by Vice Chair Murillo. At this time, I will ask that if there's any public comment that they please come up. We will put the clock on, and we will